Hope my screen is visible to everyone and my audio is clear. So, so, so the next topic is on lymphedema. We all know that lymphedema is which related to which system. So lymphedema is related to lymphatic system, right? So before moving on to the lymphedema part, I am going to highlight the lymphatic system little bit, and so that you will be able to understand about lymphedema. Uh, so throughout our lymphatic system, lymphatic fluid is flowing, right? So what is lymph? Lymph is a tissue fluid or an interstitial tissue fluid is collected through the lymphatic capillaries, then enters into the lymphatic vessels to lymph nodes. It contains protein, lipids, and water. It's called lymph. Throughout our lymphatic system, the lymphatic fluid is flowing. What are the major functions of the lymphatic system? The first one is reabsorb excess interstitial fluid, and the second one is transport dietary lipids, and the third one is lymphocyte development and the immune response. So these are the three major functions of the lymphatic system. So you all know that what is this? This is our systemic circulation, right? So why I'm highlighting this picture here is you have to understand that there is a connection between the arterial capillaries and the venous capillaries. If you look into the upper part of the body, there is a connection between the arterial capillaries and the venous capillary. If you look into the lower part of the body, there is a connection again from between the arterial capillaries and the venous capillaries. If you look into the lungs, there also there is a connection between the arterial capillaries and the venous capillaries. So the final, from the upper part of the body, the deoxygenated blood is come through the superior vena cava. It enters into the right atrium, right? From the lower part of the body, through the inferior vena cava, it goes to right atrium and then right ventricle. From the right ventricle, with the help of a pulmonary artery, it goes to the right and left lungs for the purification of blood, right? So there is a connection between the arterial capillaries and the venous capillary. So when the arterial capillaries and the venous capillaries are communicating together, what happened? So there is a chance of oozing out of fluid-like substance into the interstitial tissue space. That's called lymph. Okay. So whenever the arterial capillaries and the venous capillaries are communicating together, there is a chance of oozing out of fluid-like substance into the interstitial tissue space. That is called lymph. That fluid is absorbed with the help of a lymphatic capillaries, which is you can see in the greenish color. That is lymphatic capillaries. So there in the interstitial tissue space, wherever the leakage, the lymphatic fluid is originated, the lymphatic capillaries are responsible for take care of that absorbing the fluid from the interstitial tissue space. What is lymphatic capillaries? What is the structure of the lymphatic capillaries? It has a blind end, single layer of overlapping endothelial cells, more permeable than that of blood capillaries. So little bit, bit more that molecule also that absorb from that lymphatic capillaries. So it has a blind end. So that is why it is overlapping into the endothelial cells. Wherever the lymphatic fluids are originated, the fluid will be absorbed with the help of a lymphatic capillaries. Again, in our small intestine, I already said one of the major function of the lymphatic system is dietary distribution also. Here, in addition to picking up of the lymphatic that lymphatic fluids, the intestine contains special type of capillaries called lactees. This will pick up the interstitial fluid and also the dietary lipids from the small intestine. Coming to the lymph organs, so that lymph nodes. So I said from the interstitial tissue space, the lymphatic capillaries are absorb the lymphatic fluid from the space. It goes to the lymphatic vessels. Through the lymphatic vessels, it enters into the lymph node. So the lymph node structure is small, round and oval. located along the pathways of lymphatic vessels. Length from 6 to 25 millimeters, typically found in clusters. And the major function of the lymph node is receive lymph from the body regions, and also that will help to filter out the harmful substance from the lymphatic fluid. So it's around 600 to 700 lymph nodes in our body. Coming to the lymph organs, tonsils, lymph vessels, thymus, spleen, lymph nodes, bone marrow. So these all will help us to maybe protect against the infections, and also it will help to build the new lymphocytes in our body. So these all are the protective organs in our body. This is the next is about the drainage. Here you have to understand that from we have a right lymphatic duct and the thoracic duct. So this part of the fluid will be drained into the right lymphatic duct, and the other parts it goes to the thoracic duct. So you can see this picture. Finally, there is a connection between the circulatory system and the lymphatic system. After that, the final end will be in the subclavian vein. You can see this picture. The right lymphatic duct and the thoracic duct. There is a connection between the right lymphatic duct. It enters into the right subclavian vein, and the thoracic duct it enters into the left subclavian vein. When the lymphatic fluid, the clear lymphatic fluids are drained into the subclavian vein, that is the part of the circulatory system. That is why we are saying like circulatory system is a part of the lymphatic system. So this is a flow chart. This is how our lymphatic system works. I already said the lymphatic capillaries are there in the interstitial tissue space. Wherever the arterial capillaries and the venous capillaries are communicating together, there is a chance of oozing out of fluid-like substance into the interstitial tissue space. That fluid is absorbed with the help of a lymphatic capillaries, and then it goes to the through the lymphatic vessels. It enters into the lymph node, and then again it goes through the lymphatic vessel. Again, it enters into the another lymph nodes. Through that, it goes to lymphatic duct and collecting duct. Through the finally, it enters into the subclavian vein. So the lymphatic fluids contain it might be contain bacteria, virus, and waste products. So wherever the fluid is originated, the lymphatic capillaries will be absorbing, because it has a blind end, and it can be able to absorb the a big molecule also, right? So it might be contain bacteria, virus, and waste products. So then what happened? From the lymphatic capillaries, it enters into the lymphatic vessel. Through that, it goes to the lymph node. What is the major function of the lymph node? The lymph node will filter out the harmful substance from the lymphatic fluid. That is the major function of the lymph node. The lymph node will segregate the lymphatic fluid. Whether there is any infection, maybe bacteria, virus there, that will try to destroy the infections from the maybe bacteria or virus from the lymphatic fluid. The clear fluid will be drained into the lymphatic system, and then it goes to the circulatory system. The waste product is flushed out from the body. So now we are moving on to the lymphedema. I hope the anatomy part is clear to everyone. Are you with me? Is it clear? Yes. Thank you. So now we are moving on to the lymphedema part. What is lymphedema? Lymphedema is the pathological accumulation of protein-rich lymphatic fluid into the interstitial tissue space due to an imbalance between the interstitial fluid production and transport. There is an imbalance between the production and transport. Here, the production will be there wherever the arterial capillaries and the venous capillaries are communicating together. there is a chance of oozing out of fluid-like substance into the interstitial tissue space. The production will be there all the time, but the transportation will be difficult, because if a patient diagnosed with a carcinoma breast, the immediate treatment of carcinoma breast is total mastectomy, right? Radical mastectomy. So what is total mastectomy? Removal of breast and the adjacent lymph nodes. Why we are removing the adjacent lymph nodes? We are preventing the further recurrence. We are trying to maybe save the patients for spreading the disease from one part to another, because through the lymphatic system the disease will be spreading all over the body. So that is why we will try to remove the usually when we remove the breast, we will try to remove the adjacent lymph node also. If you remove the adjacent lymph nodes, what happen? The transportation will be difficult, because there is no lymph node for therefore that receiving the fluid from that particular limb. So that time there is a pathological accumulation of protein rich fluid will be happening into the interstitial tissue space. If there is an accumulation of fluid is there in that body, what happen? Edema will be there, right? So this is called lymphedema. What is the classification? According to the International Society of Lymphology, it has been classified as two, primary and secondary. Primary is congenital lymphatic dysplasia. So from the birth itself, there is a malformation. Secondary again divided into two, non-malignant and malignant. So from this slide, you have to understand that non-malignant and person can also develop lymphedema. So major road traffic accident, if there is a that inguinal region in nodes is damaged, that patient maybe later stage, that patients can develop lymphedema, edema, and recurrent infections, surgery related and radiotherapy. Coming to the malignant, primary lymphomas and secondary recurrence. So these are the classification of lymphedema. So this is the case scenario. Mrs. 50-year was diagnosed with carcinoma breast left with lymph node metastasis about 1.5 years ago. She underwent modified radical mastectomy with axillary dissection, followed by chemotherapy and radiation. She has been noticing that her left upper limb is progressively getting swollen for the past 3 months. She feels it heavy and experiences pin and needle sensation along the whole limb. What is the probable diagnosis? What is the diagnosis here? Anybody? Anybody? Lymphedema. So Radhi madam said lymphedema. So why you are saying lymphedema? This patient is carcinoma breast, right? And after that, she underwent a modified radical mastectomy and axillary dissection, followed by chemotherapy and radiotherapy. So these are the three major causes are there for developing lymphedema. So this patient is having lymphedema. Now we are going to learn about how to diagnose lymphedema. So from the classification, you understand that the patient, the non-malignant persons can also develop lymphedema. And also you have to understand that not all edema is lymphedema. So the other that health condition like cardiac failure, renal failure, patients can develop lower leg edema. So you have to take a proper history. What all things you will take, whether there is any unknown cause, whether there is any disease related or trauma related, whether there is any treatment related. So if you take this history, you will be able to understand that what kind of edema it is. And then you have to do the clinical examination. Coming to the clinical examination, so it has been classified into that four stages. That stage start from the stage 0. So stage 0 is a subclinical stage. So if for example, if a patient diagnosed with carcinoma breast and underwent radical mastectomy, that patient can develop lymphedema later. But when you see that patient, there is no edema. That is the subclinical state. That is stage 0. The stage 1 is, at this stage, the tissues are swollen but are still soft. It is a pitting edema stage. If you apply your finger pressure on that area, you can see this picture. You can see your finger point here. So how much pressure you give here. So you can see that like a orange peel skin. So this is the stage 1 lymphedema. So coming to the stage 2, the tissues have been fibrotic and the tissues are no longer soft. If you are not give a special attention to the stage 1, it will be go to the stage 2. And then the stage 3, the tissues are considerably hard and cartilage formation. This is the sometimes creases formation will be there. Okay, so if there is a creases there, what happened? There is a chance of dirt accumulated in between that area. There is a chance of fungal infection. Okay, so this is the class that stages of lymphedema. Now we are going to learn about the stem sign. This was the stem sign which you have seen only in lymphedema patients. For a healthy persons, you can able to pinch and lift up the base of the second toe and the middle finger. You can see your finger, the middle finger. If you pinch and lift up that skin, you can able to do it for a healthy person. But if there is a lymphedema patients, you will not be. Inability to pick up the fold of the skin over the proximal phalanx of the second toe or middle finger is the positive sign of lymphedema. It is called stemmer sign. Coming to the other diagnostic methodologies, soft tissue imaging, lymph vessel imaging, and bioimpedance spectroscopy. So these will help to determine the extra fluid volume, and you can able to detect abnormalities, and you can able to measure the interstitial fluid volume. But in case of congenital abnormal primary classification, if there is a congenital abnormalities there, you have to do these kind of investigations and identify the cause and treat the underlying cause. But if you look into the palliative perspective, usually the patient will come to you after chemotherapy or after surgery, after radiotherapy, or sometimes some major problems like chronic illness, chronic cellulitis problem, so other major road traffic accident, these kind of things. So that time you not need to do these kind of that investigations. You no need to spend money for these kind of investigations. You just take a proper history and understand that whether there is a lymphedema or other edema, and also you can do the clinical examination. Coming to the problems, just imagine one limb is normal, the another one is big because of the fluid volume. Pain and discomfort will be there. Tightness will be there. Heaviness will be there. They will not be able to move their affected limb without support. Fatigue will be there. Numbness will be there, and impaired mobility. They will not be move their affected limb without support. Loss of function. So these are the problems, physical problems of the lymphedema patients. Coming to the psychosocial problems, body image. So I have seen many patients. We have a lot of lymphedema patients. So whenever they come to us, they usually cover the affected limb with their own dupatta or whatever they have. They if they have a towel, they'll cover that lymphedema part with with that. So why they are covering? So if they open the public, they'll ask many questions. They need to answer many questions. So because of that, they usually when they come out in the public, they will cover the that lymphedema site. So body image is one of the major disfigurement is one of the major part. It will be affecting them emotionally because of this only they will be asking so many questions. I need to answer so many questions. It will be affecting the patient emotionally. Loss of independence. So if they want to take anything from the cupboard, they need to depend others. So this will be affecting them emotionally. Loss or change of employment. So because of this, they will not be able to continue the same work, and difficulty in wearing clothes and shoes, anxiety and depression. So what is happening next? So they will be in anxious. If you are not give attention to the anxious period, the patients will go to the depression. So it's our duty to listen the patient and understand their concerns, why what they are understanding about this edema. So maybe they might be thinking like, my disease is spreading to my hand also. We all know that what is lymphedema, but the patient doesn't know what it is. So they will be thinking like, my disease is spreading to my hand also. What you have to do is, when they come to you, you have to sit and listen the patient and explain them what is happening and why this edema is developed. And this is one of the constant remainder of disease, because if there edema there, they will constantly think about their own disease condition, and social isolation will be there. So they will not move out from the house, because of they are expecting too many questions. Coming to the management part, I have only 45 minutes. I am going little bit fast. So if you have any doubts in between, please put that question in the chat box, so that we can able to uh, answer it in the last. So coming to the management part, there are 4 principles of management: skincare, massage, compression, bandaging, and exercise. So these are the 4 principles of management of lymphedema. And the another option is intermittent pneumatic compression pump. So I'm uh, covering the intermittent lymphatic compression pump later. Coming to the skincare. So now you have to understand that you need to understand that there is no lymph node in that area for fight against bacteria. So whenever you are going to do the lymphedema management, you have to do the measurement. You have to give a comfortable position, and from the if you take the upper part of the upper hands edema measurement, you have to see that ulna, head of the ulna plus 2 centimeter, then every 4 centimeter. You have to mark the point first, and then you can take the circumference. So when you look into the lower limbs, from the angle joint plus 2 centimeter, then every 4 centimeter. So, skin care is very, very important. I already said there is no lymphocytes are there for fight against bacteria. The lymph node we already removed. So, if there is a chance of infection, so you have to tell them, apply simple moisturizing cream just after bathing, and meticulous drying between the digits. In between the digits, there is a chance of, if there is a edema there is a chance of dirt accumulated in between the digits, so that the patients will get fungal infection. Avoid injections and venipuncture. Usually, if you give an injections and venipuncture, sometimes it will not happen anything. But if there is any unhygienic practice, or if you are not doing aseptic, you are not practicing aseptic techniques, there is a chance of infection entry that through that prick. So that if there is a infection in that bacteria enter into that area, so it go up, right? There is no lymphocytes are there, cellulitis will happen. So what you have to do is, if there is a lymphedema there, you should not give injections or venipuncture on that area. Avoid using Rosacite, avoid blood pressure cups, and it will affect it. That time will be that affecting the collaterals. Avoid injury. So usually most of the women which they are used to work in the kitchen, the accident cut can happen. But the thing is, if there is a cut happen, they have to keep that area clean and dry. If there is any signs and symptoms of inflammation, they have to take an antibiotics for that, and make sure that there is no that uh, cellulitis. So otherwise there is a problem. So you have to tell the patient, this is very, very important. And also avoid carrying heavy things. If they take heavy things, what happen? The circulation will increase, and if the circulation will increase, what happen? The production will be increased, so that the edema will increase. The next principles of management is massage. There are 2 different types of massage: manual lymphatic drainage and the simple lymphatic drainage. So the manual lymphatic drainage is done by the trained professional like nurse, doctors, and the physiotherapist can be do. And the simple lymphatic drainage is done by the patient with the help of a volunteers or a family member. Okay. So the major difference between these is the patient should not touch the affected area for massaging. So here you can do the simple massage, but the patient doesn't know how much pressure can be given. Okay, if you tell the patient to give a massage, they will start give good massage. If you give good massage, what happen? The production will, the circulation will increase, the arterial, that capillary filtration will increase, and so that the production will increase. So you have to tell them all other points they can do. They can take a deep breathing exercise so that all internal lymph organs, lymph nodes will get stimulated, and then stimulate the superficial lymph node like neck area, axillary area, and groin. These all areas. So if there are periauricular area, submandibular lymph node, and supraclavicular lymph node. These all will be stimulated, and you have to make a pathway. You are going to push the fluid from the edematous area to the non-edematous area. So before that, you have to make a pathway where to where. So when you make a pathway, you can, when you remove them, so after making the pathway, you can able to stimulate the fluid. You can massage the fluid from the edematous area to the non-edematous area, and then stimulate the unaffected node and massage the proximal area first, and then go to the distal part. So if you start massage from the distal part, so when you start from here, your the pressure will lose in the that upper part, and then there is a chance of pooling of lymphatic fluid into the proximal areas. That is why we suggest that you have to clear the proximal area first, and then go to the distal area. So if there is a trained professionals there, you can do the massage for the affected area also, because here we need a gentle pressure only. So when you discharge the patient from the hospital, you have to tell them they can do the deep breathing exercise, they can stimulate the superficial lymph node, they can apply bandages, and again they can do some few simple exercise, again take a deep breathing exercise, and that elevate the lymph and lie down for a few hours. So this is how the manual lymphatic massage done. If you look into the upper part of the body, you have to stimulate. You have ask the patient to take a deep breathing exercise, and stimulate the that opposite side of the lymphatic axillary lymph node. Because after deep breathing exercise, you can stimulate the superficial lymph node, and then it goes. You can do the opposite side of the uh, unaffected side. Okay, and then you have to make a pathway. You can see this arrow. You have to make a path. You are going to push the fluid from here to here. You have to make a pathway. There are lot of lymph nodes and lymphatic capillaries are here for carrying, ready to carrying the fluid, extra fluid. So for that, you have to prepare them. You have to give some massage and stimulate them and make the pathway. So this is the proximal area. You have to clear this part first, and then you go to this area. From here also you have to clear. So here also, after clearing this part, you have to come here and again give that massage from here, and massage from that distal to the proximal. So this is how we used to do the manual lymphatic drainage. If you look into the lower limbs, see here you can ask the patient to take a deep breathing exercise, and then you can stimulate the superficial lymph nodes and make a pathway, and you can stimulate massage from here to here or here to here. Wherever you can, you have to massage, and from after that clear the proximal part, then you can move on to the distal part. This is how we used to do the manual lymphatic drainage. Coming to the contraindications, these are some contraindications for annual lymphatic drainage: acute cellulitis, renal failure, unstable hypertension, severe cardiac insufficiency, ascites, superior venous obstruction. So what why these all are contraindications. So if there is a acute cellulitis there, pain will be there, you will not be able to touch that area, inflammation will be there. So that time the patient should take an antibiotics for that. Once that cellulitis comes down, then you can do the active management. Coming to the renal failure and unstable hypertension and severe cardiac insufficiency, you are going to push the fluid, extra fluid, right? That accumulated fluid from one area to the another area. So sometimes because of the fluid overload, the patients will develop breathlessness. Again, ascites and superior vena cava obstruction, especially if there is a superior vena cava obstruction there, if there is a upper part edema, if you massage that area to here, again the blockage is there, no, because of it could be intrinsic tumor or the extrinsic tumor. So already the blockage and the difficulty is there. Again, you are pushing the fluid from one area to that area, chest area. So again, the patients will develop more breathlessness. So you will avoid these conditions. You will not do active management for these kind of patients. The next management is bandaging. You have to give a spiral bandaging first, 50% overlap. So 50% overlap you have to do, and then usually after 2 weeks you have to tell them to come back for review. If they are able to manage, if they are able to tolerate the bandages, then you can move on to the figure of eight bandages. If you the figure of eight bandages, that is multi-layer bandage is good, but if you if you give a multi-layer bandage to the patients, they will not be tolerate and they will not come back for review also. They will be anxious and they will be worried about the more compression, and they usually decide that I will not continue the treatment. So better to start with a 50% overlap, and then you can move on to the figure of eight bandage. And then if you look into the lower limbs also, the same way you have to give attention to the figure finger also, and then you can start initially you have to start with the spiral bandage, and then you can move on to the figure of eight. And when you apply spiral the crepe bandages, you should not directly apply on the hand. You have to protect the hand, that skin, with a small cotton roll or a small cotton linen. Coming to the fourth principles, exercise and elevation. After bandaging, you have to educate the patient for a small that exercise, one for fingers, one for wrist, and one for elbow, and one for shoulder. So, and then again you have to tell them to take a deep breathing exercise and ask them to elevate the limb for few hours and lie down. So this is how we can able to relieve the lymphedema. So this is the another management of another measures for management of lymphedema, intermittent pneumatic compression pump. So it is an electrical air compression pump attached to the inflatable plastic garment that is placed over the affected limb. So there is a machine called like a air mattress machine. So we can able to adjust the pressure and adjust the duration. What you have to do is, if there is a stage 1 lymphedema, like pitting edema stage, it will be helpful. You can insert your affected limb into that garments, and we can able to adjust the pressure. So the machine will give a continuous pressure so that the fluid will move up. So there are two complications of lymphedema. One is cellulitis and the another one is lymphoria. One is cellulitis. The cellulitis I already discussed. If there is a cellulitis there, you should not do any active management for lymphedema. You have to ask them to take a proper antibiotics and control the cellulitis. If the cellulitis control, then you have to do the active management. Okay, so our main aim is to control, maybe cure the cellulitis, and then once the cellulitis comes down, then you can move on to the active management. The second complication is lymphoria, leaking out of lymphatic fluid from the lymphedema site. So for that, what you have to do is you can apply maybe protect that lymphoria site with a Gamgee pad, dressing pad, and apply crepe bandages. So there is no the contraindication. You can apply crepe bandages so that all extra fluid will ooze out from that area. Thank you. Any doubts? We have 10 minutes. If you have any doubts on this, please ask me. If you have any doubts, like related to palliative care or related to subcutaneous infusion or related to lymphedema, uh, if you have it, please ask. Thank you.